My name is Jamie DuPont. I'm a registered nurse. I work in a travel ICU in Conway Medical Center, South Carolina. I have recently taken part in a collegiate debate regarding North Carolina House Bill 325, the Opioid Epidemic Response Act. While discussing this topic, I found the best argument supporting this piece of legislation is that it will be providing an increase in access to office based opioid treatment for opioid users. It will provide more access to the medication Suboxone, which is used in opioid treatment of opioid addiction. This bill also will eliminate duplicative state registration for prescribers, which has been a proven barrier in limiting access to treatment and Suboxone. Access to and increase in physicians with prescribing capabilities of Suboxone will allow addicts to have a more direct route to the resources that will help them recover from opioid addiction. One of the best arguments against this piece of legislation is in relation to the syringe exchange programs, or SEPs. SEPs, funded by the government, discriminate against individuals with chronic illnesses such as diabetes, as they also rely on needles for treatment. Needle exchange programs, or SEPs, have not been proven to decrease the transmission of hepatitis C virus and are not logistically allocated in places that are in need of these programs. This essentially means that these specific programs are only effective for a small percentage of the population, as they are only reaching a small percentage of the population in certain areas of the country. Lastly, needle exchange programs, or SEPs, do not account for the money that will be still spent on management and treatment of chronic wounds and abscesses acquired by the use of needles. Continuing to promote the use of needles, although sterile, will still have its own sets of pros and cons. As of July 22, 2019, Governor Cooper has signed this bill into law. I do, however, support this bill, as I believe there are some major benefits to increasing the access to Suboxone and increasing the access to physicians that are able to prescribe Suboxone. Suboxone is more potent and longer lasting than morphine. It has the ability to relieve pain without becoming chemically dependent or developing a tolerance with chronic use. This bill will also allow individuals to test for contaminants in their opioids prior to use. Other more potent drugs that may have entered these substances can now be identified prior to injection or ingestion. This alone will reduce opioid overdoses, especially when there are a variety of drugs that could be mixed in with the opioids as it is contaminated. Lastly, the syringe exchange program will not only reduce the amount of bloodborne pathogens that can be spread through IV drug use, it will help reduce exposure to medical personnel as well. Syringe exchange programs will also provide nurses with resources for addiction and options to prevent the further spread of disease throughout the community.